Good day, ma'am. I am Krishna Del Tayopon, your nursing aide for today, and today I will going to perform removing an indwelling catheter. For the goal, the catheter is removed without difficulty and with minimal discomfort. Assessment: review patient's medical record, including physician's order, and note for the period of time catheter was in place. Then for planning, prepare necessary equipments and supplies. Then close curtains around the bed and close the door of the room if possible. Then discuss the procedure with the client and the client's ability to participate with the procedure. Then for equipments, syringe same size as the volume solution used to inflate the balloon, waterproof pad, sterile specimen container with correct label, then 25 gauge 1/2 needle, then alcohol swab, and non-sterile disposable gloves. For implementation, we need to follow the policy and procedure. Then to remove retention catheter, the nurse must follow the steps. First, obtain receptacle for the catheter, such as disposable basin. Next, ask client to assume supine position as for a catheterization. Then, obtaining sterile specimen before removing the catheter is only optional. We can check for the agency protocol. Then, remove catheter securing device attaching the catheter to the client. Then, apply gloves. After applying gloves, then place towel between the legs if the client is female, but if the client is male, we can just place towel over the thigh to protect him from any secretions from catheter when we remove it. Then next, insert the syringe into the catheter port of the catheter. Then withdraw the fluid. Then we need to remember that we do not need to pull the catheter while the balloon is inflated because it might injure the urethra of the client. Then after all the solution was removed from the balloon, we can gently withdraw the catheter and place it in the receptacle. Then afterwards, dry the perineal area using towel. Then next, measure the urine in the drainage bag. After measuring, we can remove and discard gloves, then perform hand hygiene. Next, we need to record the removal of the catheter, including the time and catheter, the time and catheter was removed, then the amount, color, and clarity of the urine, the intactness of the catheter, then provide the client with either a urinal, bedpan, or commode toilet collection device that he can use each subsequent unassisted void whenever he want to urinate. Then following removal of the catheter, determine the time the client went first void, then the amount void during the first 8 hours, and we need to compare it to the output of the client's intake, then observe for the dysfunctional voiding behaviors such as greater than 100 per void, which is might indicate urinary retention. If this occurs, then perform an assessment of PVR using a bladder scanner if available. Then generally PVR greater than 200 ml will require straight catheterization if needed. And for recording and reporting, so we need to record in nurse's notes the time of removal of catheter, condition of urethral meatus, and character and amount of urine. Then we need to record the urine empty from drainage bag on the output form. So at 7 p.m. the catheter of patient 044 was removed. The urethral meatus was intact. The urine is normal with 100 ml, and the amount of urine is, and the urinary bag is empty.